about all the topics that are trending in the medical world. And joining me this week by Zoom and unusually on a Monday, we're happy to have Dr. Syed Hussain with Trinity Health of New England. Doctor, good morning. How are you?
Hi, Tim. Good morning. Actually, good evening from Taipei.
From Taipei, the world traveler. But hey, the knowledge is always welcome wherever you are. Let's get right to it. Some new research from the Journal of the American Heart Association said using cannabis in any form may raise the risk of heart attacks and strokes. Now, smoking, they say, poses the greatest risk. But again, any form, even eating edibles, could have some health issues. So what do we need to know about this? Just how great are these risks?
Yeah, this is very concerning, Tim. Again, it points to the fact that we still need to learn more about commonplace use of marijuana in folks. We've seen, for instance, over the last several years, 24 states now actually allow it's legal to use recreational marijuana, still not allowed, permissible on the federal level. However, the study points to an independent risk of heart attacks, heart disease, strokes from marijuana use. So more research is needed, but it basically tells folks that, you know, the misconception or misperception that marijuana is safe to use and it has no side effects is not true.
Got it. All right. Well, we'll wait for more studies, too, to confirm those findings even more. We know the World Health Organization said more than 1 billion people worldwide are now considered obese, so much so that obesity, again, extreme overweightness, is even more common than just being simply underweight by any measure in most nations. Why is this shift such a big issue worldwide, and what should nations be doing to sort of stabilize nourishment?
Yeah, it's a new public health crisis on top of what has existed especially in the high income countries that we've seen, Tim. So now lower and middle income nations are also seeing there's more obesity related issues that they're dealing with rather than the historic undernourishment. So it goes on to, show that we really need a concerted effort from a public health perspective, because obesity will lead to an increase in heart disease, strokes, kidney disease, and things that we see play out in the U.S., which actually among all high-income countries is #1 in terms of obesity being a problem.
Okay. And then lastly, curious to see, Doctor, what you think about this. A study in the journal Pediatrics revealed that teens and young adults are being prescribed anti-depressants. The number of them being prescribed spiked 66% between January of 2016 and December of 2022. Specifically, they're looking at the age range of between 12 and 25. So is this bad news because more people need help? Is it good news because more people are getting help? Or is it a little bit of column A and a little bit of column B?
Yeah, I think it's a bit of both, Tim. So we've seen an uptick, especially during the pandemic. Now, a couple of reasons why it may have increases because we've seen the advent of telehealth, the widespread use of telehealth. So that may have helped folks get access to medications. But also we've seen use of therapy decline during the pandemic because of various restrictions and such. So people may have resorted to using medications more often. But here's the bottom line. We know this is a public health issue in terms of behavioral health, mental health, and the more focus that we can provide to this issue is much needed.
Yes. In general, though, is it safe to say that the amount of people who need help for these has gone up, at least maybe since before the pandemic?
It has, absolutely.
Okay, I would assume so. All right, Doctor, thank you so much. Enjoy your time. Thanks for taking the time to zoom in. And it looks like it's just about bedtime there in Taipei. So we will see you next week.